Welcome to Physiological and Behavioral Adaptations of the Newborn. In this lesson, we'll walk through how a newborn transitions to life outside the womb and how nurses support them during this critical period. Introduction: Thermoregulation. Thermoregulation is the newborn's ability to maintain a stable internal body temperature. However, many newborns experience hypothermia, which means their body temperature is below normal. That's because babies are born with immature temperature regulation systems. As nurses, we monitor both the baby's environment and body temperature, intervene to stabilize it, and educate the parents on how to keep their newborn warm and safe. Physiological adaptations. The respiratory system. At birth, breathing is triggered by mechanical and chemical signals. Chest pressure during delivery helps squeeze out secretions and amniotic fluid. Then, the chest recoils, surfactant increases, and cutting the umbilical cord completes the transition to independent breathing. Nursing care includes clearing the airways, monitoring breathing. Key nursing interventions: count respirations per minute, suction the mouth and nose, monitor respiratory effort, observe the abdomen, allow short bursts of crying, not prolonged crying. Cardiovascular system changes. After birth, fetal circulatory shunts close. We also see temporary high red and white blood cell counts. Low vitamin K, which may require injection. Nursing care includes monitoring the heart rate. If the heart rate drops below 100 beats per minute, start ventilation. If it drops below 60, begin chest compressions. Thermoregulation system. Newborns use brown fat metabolism to generate heat, a process called non-shivering thermogenesis, but they lose heat easily through evaporation, like after a bath. Conduction: contact with cold surfaces, convection exposure to air drafts, radiation near cold windows or walls. Nursing interventions include dry the infant immediately, practice skin-to-skin contact, use warm blankets, delay the first bath until the baby's temperature is stable for at least 2 hours. Avoid exposing the entire body or placing cribs near drafts. Renal system. At birth, the kidneys are immature and can't concentrate urine well. Newborn urine is clear and odorless. Expect at least 1 wet diaper per day of life, increasing to 6 to 8 by day 7. Initial urine output is around 15 milliliters, increasing to 300 milliliters daily as feeding is established. Nursing interventions include monitoring the first void, weighing diapers, encouraging frequent breastfeeding, teaching parents what to expect regarding diaper output. Gastrointestinal system. The G-tract is sterile at birth, but beneficial bacteria arrive quickly to help with digestion and Newborns have small stomachs, about 60 to 90 milliliters, and an immature cardiac sphincter, making regurgitation common. Meconium, the first stool, is thick, greenish-black, and should pass within 24 to 48 hours. Nursing care includes monitoring meconium passage, educating parents about normal regurgitation, advising against overfeeding. Hepatic system. The liver is immature and can't efficiently process bilirubin, which leads to physiological jaundice, usually seen between days 2 and 4. If jaundice appears before 24 hours, it's considered pathological and requires immediate attention. Nursing care. Monitor for yellowing of the skin or eyes. Educate families on normal versus abnormal jaundice. UCUS: concerned, uncomfortable, safety for critical thinking and prompt referral. Immune system. Newborns receive passive immunity from the mother via IgG, which protects them for about 2 to 4 months. They begin producing their own antibodies around 2 months. Nursing care. Emphasize hand hygiene, screen visitors and staff for illness. Educate parents on infection prevention and immunization schedules. Behavioral adaptations. Newborns communicate through crying, quiet alertness, gazing, and tracking. They self-soothe by sucking on their thumbs or hands. Each newborn is unique. Nurses help parents understand and bond with their baby by observing and educating based on individual behaviors. Periods of reactivity. First period 0 to 60 minutes. Baby is alert, ideal for bonding and breastfeeding. Period of relative inactivity 2 to 4 hours. Baby sleeps deeply. Second period of reactivity. Baby wakes up, is alert, and ready to feed again. Sleep and awake states. Deep sleep, still and hard to wake. Light sleep REM. Eye movements, occasional fussing, drowsy, between sleep and wake. Alert, eyes open, ready to feed. Active alert, fussy, moving. Crying, a call for a help, hungry, tired. That concludes our overview of newborn physiological and behavioral adaptations. As nurses, our role is critical in observing, assessing, educating, and responding to every newborn's unique needs during this delicate time. Keep these principles in mind as you care for your tiniest patients.